50% of the people that are diagnosed don't go get help. Not 50% of the people that are dealing with the mental illness, 50% of the people that are diagnosed don't go get help. So we have work to do. So right now, U.S. employers are spending $2.6 trillion in employee health care insurance. That equates to about $20,000 per employee per year, okay? Here's the challenge. Access is limited. 75% of your employees aren't going to be able to use your company's sponsored insurance. So you're paying 20 grand a year for insurance, and to go and get psychiatric services, you're going to have to spend 10 to 20 grand more. So what happens? I'll tell you what happens. People don't go get help, and we get to employ them, and we have to deal with them. And it presents itself in a unique way within our organizations, because nobody can afford 40 grand a year to get access to care, okay? 80% of psychiatrists aren't taking insurance, and we'll cover that here in a little while, but they're not taking insurance. Most companies hang their hat on employee assistance programs, and while they have a purpose, they only have a success rate of about 30%. And of those that do get help with EAP services, they're going to require more long-term services. And if your company is dealing with substance abuse, EAP isn't an answer, because it's at best a screening tool. So to put that in perspective, we're in the industry right next to the Mississippi River, petrochemical. If we have pipe fabrication and skids and operators, and that's what we do here in this community. If the welders, if the electricians, if the operators, if they're impaired, you have safety concerns, you have cultural concerns. That's a cost. So if we terminate them, what happens? If somebody pops out on a drug test, what we see typically is you're on a 14-day leave, you go get help. Well, if you're dealing with substance abuse, that's at best a 2-month process. So you come back to work, you go to a counselor, you come back to work, and you try your very best to do something, and it's not going to happen. You have to terminate that person. So there's a cost to terminating that person. So all their experience walks out the door. All your investment in that individual walks out the door. So that's a huge concern. So why do we have such poor access to care? Well, the primary reason is attrition. People are not, the current psychiatrists are getting older, and they're getting out of practice. Another alarming trend that we see on the national front is smart people aren't going into medicine. They're going into tech. Everybody wants to be the next Elon Musk or Mark Zuckerberg. But if they do go into medicine, they're not going into psychiatry. Psychiatry residencies have been in decline for 2 decades. That's 20 years. And when you look at those that do complete residency, they don't take insurance because of poor reimbursement. When we go to acquire a practice, or we consult with folks in this space, and we look at their contracts, most of these contracts hadn't been negotiated or changed or adjusted in 10 years. No cost for inflation. What they're told is to see more people. And so what that means is there's a burden with that. I have to hire more people. I have to deal with the set of rules with this company and that company. So what you see folks doing is taking the path of least resistance, and they just back away. Hence the problem that we have. So I'm gonna summarize this, and I'm gonna bring it more local here. $6.3 trillion, 105 lost days a year. Here, bringing it home, if you manage depression alone, you reduce healthcare costs 7-fold. Just depression.